First, you have to stop the deterioration. Then you reverse the situation. And only after that do you move in the opposite direction. Now I'm going to add some visual support to what I'm explaining. I want to draw a picture for you. So imagine a coordinate system. This is angle alpha, the angle of asymmetry. It represents the total asymmetry angle, essentially the deviation from proper vertical alignment that almost everyone has. Right-left asymmetry, front-back asymmetry, up-down asymmetry, and so on. These are all asymmetries within the body. What causes them? It could be anything, but we can sum them up and get an overall angle of asymmetry. Now, if we draw a perpendicular to that angle, it will indicate how long we are going to live. It points to a specific point. Now take a look. There are an upper curve and a lower curve. The upper curve represents people who do sports, exercise, and fitness. The lower curve represents those who don't. And at a certain point, the two curves converge because you're not changing and don't know how to change the alpha angle, the asymmetry angle. So in the end, everyone arrives at roughly the same point. That point is essentially the average life expectancy, plus or minus about 5 years. So what do we do in our work? We change this alpha angle. Do you see? As a result, the degree of asymmetry decreases, and the angle of inclination also drops significantly. On this timeline, life expectancy begins to increase. This applies to all age-related diseases, cardiovascular diseases, digestive system disorders, immune system disorders, and so on. Everything. All of it fits into this model. Let me draw another picture. At some point, the first signs appear. At some point, the first complaints arise. At some point, the person goes to the hospital. At some point, treatment begins. All of this can be arranged along a timeline. Once we've done that, we can say, right now, these are the current problems. A year ago, the problems looked like this. 2 years ago, like that. And 5 to 10 years ago, there were already issues, but in a milder form. Now we can trace these points backwards. We essentially rewind the process in strict chronological order. The person's chronological age stays the same, but their biological age is rolled back, and the disease retreats to where it originally came from. It's like a ball of yarn that has unraveled. If disease is that ball, our job is simply to wind it up. That's exactly what we work with. We're talking about degenerative processes in connective tissue, muscle tissue, the short, deep spinal muscles, intervertebral discs, menisci, and joint capsules. At the same time, we can look at it from another perspective. What's happening on the neurological level? There, we'll see specific pain syndromes and degenerative processes in nerve trunks and nerve tissue, including the spinal cord, the brain, and nerve plexuses. If we look at the vascular system, we'll see impaired inflow, impaired outflow, and disrupted microcirculation. From another angle, we might see that the body is twisted or bent. This reflects a distortion of body shape. From that perspective, we observe how the body gradually straightens. From a biomechanical point of view, we see an increase in range of motion. Then we can look at immune system markers. There will be positive changes there too. If we look at cardiovascular indicators, including heart function, we'll see improvements too, and so on. You see, we take the body as a whole and begin reversing processes at its weakest links, and then all processes begin to move backwards.